Welcome to The Gut Show. I'm your host, Erin Judge, registered dietitian and founder of Digestivehealth. I'm also your fellow IBS warrior. Our goal on this side of the internet is to empower those with IBS and digestive disorders to understand their gut better, to have a healthier relationship with their bodies, and to make confident choices to improve their digestive health. During this season, you can expect a conversation around a hot topic related to gut health, digestion, and IBS. As a disclaimer, I am a dietitian, but I am not your dietitian. So everything covered in this episode is meant to be educational and is purely information that you can take back to your healthcare team in order to make the best decisions for you. If you're new here and something just doesn't feel right in your gut, if your symptoms have led you to this podcast, I invite you to start by taking the quiz, What's Your Poop Personality? Your personality type will unveil what your symptoms may mean, what may be causing them, and what you can do about them. This is a free quiz and you can take it today at digestivehealth.com or find the direct link below in the show notes. While you're going to take the quiz, let's jump into today's episode. Now for a quick word from our sponsors with resources that might support you. Did you know that you can now order your own gut health test without waiting months for a doctor's appointment? Gemelli Biotech offers trusted, science-backed, at-home tests for conditions like SIBO, EMO, ISO, and post-infectious IBS. Their Trio Smart Breath test measures the three key gases, hydrogen, methane, and hydrogen sulfide, to detect different forms of microbial overgrowth. As for those with IBS symptoms, IBS Smart is a simple blood test that can confirm post-infectious IBS with clinical accuracy. Validated by the leaders in gut health, these are tests that you can trust and tests that you can take comfortably from your home. So go to getgutanswers.com to find out which tests are right for you and use the code ErinJudge25, all one word, ErinJudge25, to save $25 on your order.
Are you taking a prescription medicine for irritable bowel syndrome with constipation, or IBS-C? If symptoms like constipation, belly pain, and bloating are still bothering you, it may be time to try something different. Ibsrela, tenapanor, is a prescription medicine used to treat adults with IBS-C. Ibsrela works differently to relieve the symptoms of IBS-C so that you can focus on what's important to you. Ask your doctor if Ibsrela could be right for you. Do not give Ibsrela to children less than 6 years of age. You should not give Ibsrela to children 6 to less than 18 years. It may harm them. The most common side effect is diarrhea, sometimes severe, and your child could get severe dehydration. Stop taking Ibsrela and call your doctor if you develop severe diarrhea. Do not take Ibsrela if you have a bowel blockage. Tell your doctor if you are pregnant or breastfeeding and about the medicines you take. Other common side effects include swelling or a feeling of fullness or pressure in your abdomen, gas, or dizziness. Learn more at ibsrela.com/PI or call 1-844-IBSRELA and press option 4. Ready to try something different for your IBS-C symptoms? Ask your doctor about Ibsrela.
Is a gluten-free diet just not cutting it, or maybe not even necessary when it comes to chronic symptoms like bloating, gas, and pain? Research actually shows that in those without celiac disease, it's actually the FODMAP, the carbohydrate fructan in wheat, not gluten, that causes symptoms most often. This means that you may not need a strict gluten-free diet to see symptom relief. And it means that if you are reacting to fructans, there may be more foods in your diet beyond wheat that are causing you symptoms. This includes foods like garlic and onion, and even some fruits and vegetables that can sneak their way into your diet and contribute to those chronic symptoms. You can choose to limit these foods and reduce your overall fructan intake in order to avoid symptoms. You also have the option to break the fructan down using FODzyme, an enzyme blend that targets fructan, lactose, and GOS FODMAPs, and that will help you break these FODMAPs down to then prevent the symptoms. Learn more about FODzyme in the show notes, and you can use the code THEGUTSHOW for 20% off your first order. And now let's get back to the show. Welcome back to The Gut Show. Today, we are very lucky to have a really exciting guest, Dr. Janelle, who is someone I've been following on social media for a while. I've loved her content, and I'm so excited to be able to share her expertise with you. So if you don't know who Dr. Janelle is right away, she's a pelvic floor physical therapist and pelvic floor dysfunction expert. She is the founder of the Vagina Rehab Doctor, which is an online platform for awareness and education, as well as a virtual practice or maybe physical practice. We'll get into all the pieces of that specializes in vaginismus, painful sex, and all forms of pelvic floor dysfunction. So Dr. Janelle, welcome. I'm so glad you're here.
Thanks so much for having me, Erin. I'm super excited. I'm also a fan of your work. I think I was watching a reel about constipation and you were like in the tub and you're like, I've tried everything and I'm still constipated. And at that moment, I was like, so relatable. This is so good. So I'm excited to talk with you and to share with your audience today.
Amazing. Yeah, I think we both, as professionals online, take a bit of a, it's not that serious kind of approach to our content and allow ourselves to be silly and be relatable and highlight topics that I think are very taboo or have like maybe some shame tied around them in a way that
Mhm.
kind of lets the guard down. And I appreciate that about your content as well, because you definitely like talk about things that a lot of people don't maybe want to talk about or they don't have the open door to, which we're definitely going to get into today. Before we get too deep, I do want you to set the stage. So briefly, what is the pelvic floor? What is pelvic floor PT? If someone's just tuning in and they have zero idea what we're starting with.
Sure. So the pelvic floor is a muscle group that sits at the base of your pelvis. So where you feel your tailbone in the back and also where you feel your pubic bone in the front, the muscles that connect them, they hang like a hammock, and that's your pelvic floor. So it's supporting all of your pelvic organs, including your bladder, your uterus and vagina, and then also your rectum. So when the pelvic floor muscles are functioning well, we're going to see things like good bladder control. We can, go 2 to 4 hours without needing to pee. We can cough, sneeze, laugh, jump without any urinary leakage. We're also going to see good bowel function. So we should be able to have a bowel movement without pain, without bleeding, without strain, good formed bowel movements, all of that. And then also sexual function and pregnancy postpartum. So a lot of people know pelvic floor therapy for the pregnancy postpartum. But I focus in on sexual function. So, is sex pain free? And is it allowing you to connect with your partner in a way that doesn't bring anxiety and fear and disconnection? So, we primarily help women and people struggling with vaginismus, which looks like impossible penetration or very difficult penetration, and or sexual pain. So, in a nutshell, that was the shortest nutshell I could give. But that's Vagina Rehab Doctor. That's my brand name. And those are the people that we help.
Amazing. And I love that the pelvic floor, I think, is getting a lot more attention, especially in the GI world. For a while, I felt like there was a big disconnect, especially with my patients that, I would talk to about pelvic floor or pelvic floor assessment or just some
Yeah.
questions assessing, what they already know or how they're connected with their pelvic floor in relation to their bowel habits. And a lot of people didn't know for the longest time of what their pelvic floor even was. And even people who had gone through multiple pregnancies and deliveries, like a lot of times didn't know. And
Mhm.
then there would also be the conversation of, well, I've never been pregnant or I've never had a child. And then there was a disconnect on could your pelvic floor still be involved in GI? And now I feel like there is more attention brought to pelvic floor, which has been great. And I'm really excited about that. So we're definitely going to talk a little bit about the GI side, but I wanted to bring you in to talk even more about a piece of it that I do think is still a bit taboo, but something I get asked about a lot, and that is the sexual dysfunction, intimacy, conversation of it all. So why did you decide to go that route with your practice? Because you're right, a lot of people do focus on the postpartum delivery side of things or in GI, but the sexual function side, I don't think gets a lot of attention. So why did you decide to take that route, especially on online and on social media?
Well, initially I didn't decide to take that route. I went in with a very open mind about the pelvic floor. So when I finished PT school, I started treating a lot of bladder dysfunction. So a lot of people struggling with just getting to the bathroom without peeing on themselves, or women after childbirth that were having bladder issues. But then when I started working at Northwestern, which is a hospital system in Chicago, I was working with urogynecologists. So I saw sort of the full breadth of all types of pelvic floor dysfunction. And that's when I got exposed to more of the vaginismus, the sexual pain, and how desperately women wanted to fix this part of themselves, but there was little to no awareness around it. So that's where I started just focusing more on education through my content on Instagram. And with time, I started to get more passionate about sexual pain and vaginismus but I was still trying to treat everything. I was still trying to do, oh, you have prolapse, let me help you. Oh, you're constipated, let me help you. And it wasn't until I hired someone else that actually started working with me. So it's three of us now, myself, Dr. Tina, Dr. Nirja. And Dr. Tina, her full name is Martina. She was like, why don't we just focus in on sexual pain? This is where we're getting the most results. This is where people really need the support. And let's just do it. Like, let's be known for vaginismus and sexual pain. And so that was when I was like, all right. It was kind of difficult though, because I felt like almost I was doing a disservice to all the people following me who probably didn't have that problem. But it was the best decision ever. It's so much easier to get known for one thing when that's the main thing that you talk about. So that's essentially how that happened for us.
That's really cool. And I'm sure that's helpful for people who are struggling. I see that even in the GI side of nutrition, where having a more narrow specialty, I think helps people feel like, okay, I'm in the right place. I'm connected to what you're talking about. I'm connected to this experience and I'm home in this environment because this is like my main goal. So it helps, I think, even the consumer, the patient, the client, the listener be able to really connect in that world. And unfortunately, I guess it's still all connected to everything else too, right? So I'd love for you to talk about the relationship and what you see in practice with such sexual dysfunction in relation to also like IBS and the GI side. I know there's a little bit of data that's showing like, a good majority of people with IBS have some level of sexual dysfunction or, troubles with intimacy more related to quality of life. But what do you see in your practice with that relationship?
For gut and the pelvic floor.
Yeah.
Yeah, so it's a bi-directional relationship. So if you have gut issues, your gut issues can actually drive pelvic floor dysfunction. An example of that is if you have slow transit time and your bowel movements just don't happen as frequently as they should. um, it's going to be easier for the poop to be more dehydrated because it's sitting in the colon for longer. So by the time it's time to actually get it into the toilet, you are like straining and pushing very hard, which seems like the most natural thing to do. Like if it's not coming out, push harder. But that's actually going to weaken and strain the pelvic floor muscles because it is a very vulnerable muscle. It's fighting gravity all day long. It's holding up all of our pelvic organs. And so, and we're not even talking about if you have a lot of anxiety in your body or if you have a history of trauma, your pelvic floor is already a bit more vulnerable and fatigued because it's probably tense and tight. So a tense and tight muscle is going to fatigue quicker than a muscle that is relaxed at rest. And so, any of those gut issues, IBS, Crohn's disease, these things can drive the pelvic floor to be weak, strained, painful, even because the pelvic floor is part of the digestive system. And then on the other end, if let's say you don't even have gut issues, but your pelvic floor is not letting go when it's time to relax and open, or maybe it's just not coordinated. Like me, I cannot dance all that well. So I give me something complex, a dance move, a trend online. I'm gonna struggle with it in terms of the coordination. So what that means is just you're not on beat when you should be on beat. And so with the pelvic floor, when it should be opening, it's closing. So for some people, it's not that the muscles are too tight. The muscles are confused with what they're supposed to do. So they're tightening or contracting when they should be letting go. And then that could lead to gut issues because you're not getting your toxins out, your poop out in the way that you should or in the time frame that you should. So those are, I would say, the basis as to how the pelvic floor is connected with the gut. And so I think everyone with any type of gut issues, constipation issues, pelvic pain issues should be screened for pelvic floor dysfunction.
I agree. And I like how you mentioned that it's not always only one driving the other, like they can kind of feed into each other. And even,
Yeah.
the coping behaviors that you have for one, you might also be causing problems with the other. And, there's a bit of I guess, a web that can be tangled there that sometimes needs to be untangled. very much with multiple providers, like the nutrition piece and maybe a medical piece, and also the physical therapy side. With vaginismus, is that tightening? Is that primarily like tightening and dysfunction also what's going on, like what we see in the rectum with pelvic floor dysfunction in relation to constipation? Is that what is also happening in vaginismus?
So vaginismus, there's a ton of misunderstanding regarding what's causing vaginismus. If you go online, even right now, you'll look up vaginismus and it'll say an involuntary muscle spasm causing pain with insertion that can even make insertion impossible. That is actually disproven like 10 years ago. But because that definition has been so common for 30 plus years, people still believe that it's this muscle spasm. But recent research and literature has shown that it's actually the muscles being too tight. So they're not necessarily spasming, but just even when you're resting, when you're sleeping, when you're watching TV, they're holding way too much tension than they should. And so even when you're aroused, even when you want to have sex, even when you want to put in a tampon or get the pelvic exam, if the muscles just are not opening enough, I mean, it's going to be like fighting gravity to put something through a hole that doesn't have enough space there. So that leads to a lot of pain, burning, stinging. A lot of people say it feels like they're hitting a brick wall because the muscles are too tight. And then for many people, there's like a fear of pain. So maybe even from the time they were little, they had this fear of like a tampon getting stuck in their vagina, or they had a fear of sex being excruciatingly painful. So many platforms will also describe it as like psychosexual. Usually there is some level of psychological fear or avoidance going on, but without treating the pelvic floor, generally it's nearly impossible to get to pain-free insertion and pain-free penetrative sex. Um, so I hope that was a good description.
Yeah, definitely. I think it's good to talk about. And I asked because I'm curious how often, because I know that, GI is not your first focus, but I can't imagine that someone with vaginismus also doesn't struggle with dysfunction or constipation as well, or pain even in on the GI side or with bowel movements. Like, is that true? Do you feel like that is fairly common, that there is a hand-in-hand relationship, that if someone has vaginismus, they're also struggling with constipation or even pain with bowel movements, pain in the rectum, that those signs as well?
Yeah, very commonly, if one person has any type of pelvic floor muscle dysfunction, that another opening can struggle too. I mean, it can go from the clitoris all the way to the rectum. Let's say you have clitoral pain, you could also have like constipation and have no idea that they're connected. I would say that it's not always. So many times we see women that have vaginismus and cannot have any intercourse, married for 5 years, sex is literally impossible, and they have no constipation at all. However, I would say it's not surprising and it's very common to see that they have a little bit of both. Maybe they can have bowel movements every day, but they have to strain, or there's pain, or they have a history of hemorrhoids. That's a really common one. And they don't know that hemorrhoids is generally because of some level of muscle dysfunction going on, making you strain the hard poop, and then there's tearing of the lining, and it's just this cycle. Another thing that we see really commonly is that if someone is constipated, they'll notice more pain and difficulty using their dilators. So dilators, this is a dilator right here, are these like plastic or silicone cylindrical shaped tools that can help you slowly stretch the vagina and get your brain used to insertion, so that you can have pain-free sex, pain-free insertion, pelvic exams with no issue. And so if someone's really constipated, I mean, the rectum is right behind the vagina. There's not like this big space in between. So a lot of people will notice that constipation flares their vaginismus, or it makes dilators more difficult. Or some people that have sex and it's hurting, like they can have intercourse, but it's not pleasurable. It's not even pain-free. It's like excruciating or uncomfortable, that they'll notice difficulty pooping after. So if someone has a tight pelvic floor and they have an orgasm, after that orgasm, they may notice that they can't poop because an orgasm is a tightening and relaxing of the pelvic floor. So we're tightening a muscle group that's probably already a little bit too tight, which can flare up any issues regarding bowel emptying and bowel movements. So definitely related, not always, but a happy butt is a happy gut, and a happy gut is generally a happier vagina. So it's all it's all related.
Absolutely. I agree. And I'm glad you hit on all of that, because I think, one thing that I'm on a mission to keep making GI doctors change this too. But like, GI patients are rarely screened on the front end for painful sex, painful insertion. It's not always screened for. And it's such a simple question. And the amount of clients I've had, male and female, who have never been asked that question of, do you have any pain with intercourse or any type of insertion at all? And a lot of times my really severe constipation clients do, and no one's asked them that question. They're like, yeah, I can't get pap smears, or yeah, like I do have a lot of pain. Sometimes I'm able to have sex, sometimes I'm not. And they have never been asked that question on the GI side. And so then they miss the opportunity for pelvic floor assessment and a referral to a pelvic floor physical therapist and all those pieces. So hopefully people are hearing that. And if you've never been asked that question, it's not abnormal. Like, this is something that happens and there are solutions. So before we get into kind of the intimacy side, I do want to talk about that some more, since that's going to relate to both our GI patients, but also your patients for sure. What do? You mentioned the dilator piece, but how do you treat vaginismus, or kind of start addressing pelvic floor dysfunction in relation to sexual dysfunction? Now for a quick word from our sponsors with resources that might support you. Are you struggling with bloating, constipation, or diarrhea, and you're still waiting to see your doctor? Take control and get answers with Janelle Biotech's at-home gut health tests. The Trio Smart Breath Test is the only at-home test that is validated to look for all 3 gases that are associated with microbial overgrowth: hydrogen, methane, and hydrogen sulfide. That means it can detect SIBO, EMO, and ISO in one simple test. It ships right to your door, no appointment needed. You take it and you send it back, then you get answers. If your IBS symptoms started after a stomach bug or food poisoning, it could be post-infectious IBS. The IBS Smart Blood Test is a quick at-home test to help identify it. Fun fact, 1 in 9 people who get food poisoning will end up with post-infectious IBS, and most don't even know they have it. With both of Janelle Biotech's tests, you'll get clinically backed results in about a week, and you can take them straight to your provider. No waiting, no referrals, just answers. Find out which tests are right for you at getgutanswers.com and use the code AaronJudge25, all one word, AaronJudge25, to save $25 on your order. You can also find all these details in your show notes. As someone with IBS-C, I've struggled with symptoms related to food for the majority of my life, specifically FODMAPs. My personal triggers, beans, dairy products, garlic, and onion, would leave me feeling bloated and uncomfortable after meals, especially whenever I was eating out or traveling or living my life outside of my home, which meant I either had to just deal with the symptoms or eat bland, awful food and miss out on experiencing the social interactions and the joy of food. Finding FODzyme was a game changer for me. This is an enzyme blend that targets FODMAPs, specifically the GOS that's found in beans, fructan in the garlic, onion, wheat, and even different fruits and vegetables, as well as lactose in dairy products. I stash this in my wallet, my husband's wallet, every bag I own. I take it with me everywhere I go so that I can simply sprinkle it on my meals, eat with confidence, and feel my best after. If you want to try FODzyme for yourself, go to fodzyme.com and don't forget to use the code THEGUTSHOW, all one word, THEGUTSHOW, for 20% off your first order. And now let's get back to the show.
Great question. So we do everything remotely. All of the doctors that work with me were all certified pelvic floor therapists that have worked in person. I worked in person for about 4 or 5 years. And my colleagues, they worked in person for about 2 years before coming to work with me. So everything is remote. Everything is done via Zoom. And on that first visit, it's really a lot of data gathering. We want to know your history. We want to know, at one point, did you know that something was wrong? If you're having sex, is it painful? Is it not? So we're gathering a ton of information, and then we want to do like an actual screening of your pelvis and your pelvic floor and vulva. So we are essentially guiding our clients on sort of how to be their own healer, right? Because we're not using our hands to treat you, but we can communicate. I mean, we're we're adults. We know how to tell you how to check something. So we're on the other side of the camera. Usually your camera is off always, unless we are just talking or doing exercises. So we are showing our patients essentially, how do you check for pelvic floor tightness? How do you find where your pain is coming from? So they're actually using their own hands, internally and externally. Um, Many times when we find an issue, we're teaching them how to understand what their pain means. So a lot of them will insert a finger, and maybe they can only insert their finger like an inch into the vagina and then it stops. And for a lot of people, that's happening because the muscles at that depth are too tight and need to be released manually, with some type of tool, whether it's your finger, a pelvic wand, a dilator, exercises, breathing. And so we're literally helping them to better understand what's happening instead of just trying to fix them while they just sit there. And so each week it's one-on-one. We're guiding them with movement. A lot of them, it's also thought processes. So they think every time they feel pain that it's a problem. And this is what's driving them to probably not use their dilators anymore, or not try to insert a finger, because no one has shown them that, okay, if you're using a therapeutic tool like a dilator or even your finger and there's pain, but we're not trying to only decrease the pain. We're trying to address what your muscle is like. Is your muscle guarded? Is your muscle stiff? Is your muscle clenching? We're trying to change those patterns. And generally, when we change the muscular behaviors, the pain goes down as well. And so just giving our patients that validation that, you're not making your body worse. You do need to know when it's too much pain. So that's where the expertise comes in. But it's very hands-on. It's very much inner healing work. You're in your own vagina. So for a lot of people, that's something that they've never been taught. Clinically, we're generally letting the provider do most of the hands-on work, especially for pelvic floor PT. So this is very much different when we see people that haven't done that before, and that generally makes a huge difference. So
Yeah.
that's what it looks like. A lot of movement too. So we do exercise with our patients and train them on their nervous system regulation too, because that's a big piece. A lot of fear going on. So that's what we're doing in each session, and also emailing them, DMing them, trying to stay in contact with them through the week as well.
That's great. And I think, if anyone's listening that has struggled with difficulty like connecting intimately with a partner or with sex specifically, that can probably feel a little intimidating and a little overwhelming, because I know on the GI side, a lot of times the disconnect with intimacy, even outside of the pain or discomfort itself or what the body is doing, there is a lot of perception of their own body and their value in relation to that. And I know in GI, there's a lot of, well, I feel disgusting, or like I feel unsafe, or I feel like in their own body, not necessarily with their partner. How do you start that conversation? Because I'm sure there's some gap there, right, between where someone starts to then being able to provide their own manual therapy and build confidence in their own body to then connect intimately. This middle gap, I'm sure, is strong in your patients. So how do you start those conversations, and what does that look like?
Yeah, so a lot of our clients have been following me for a while. So they know how crazy I am. They know they know how self-affirmative I am. I do a lot of workshops or master classes where we talk about it like, hey, this isn't your fault. This is your experience. And we work a lot through, not necessarily in the one-on-one session. In the one-on-one, I would say it's primarily about healing the physical pain with a sprinkle of affirmations and helping them retrain their thoughts. But generally, by the time they get to us, they're ready to work through that physical pain. But before that, I think just through my content, my workshops, they've sort of at least learned or heard that your worth isn't dependent on your vagina. You know, your worth isn't dependent on a medical condition. You're worthy, and you're also worthy of a patient partner, a partner who understands you and loves you. And this is not your final stop. Like, boo, let's get it together. We do have to do some work, but it's very much worth it on the other side. And so I think that's a big part of it. Sometimes we do give them homework, like, all right, I want you to journal and write down why you think that you're not worthy, or why you think that you're not safe, you know, touching your own body. And that will probably help them become aware of like where that's coming from. And usually it's like a source that can't be trusted. Like maybe it was some random doctor that sucked that told you that, oh, your poor husband, he has to put up with this. And you've been hearing that voice or whatever it is. We're supporting them, but we're for sure supportive of sex therapists and counselors, and want to make sure that we're referring as often as we can. Um, but we are very much big on making sure that your thought process is a healing perspective, right? If you're saying, oh, I just can't put this in, or I keep having to force my dilators in, it's like the language is not healing. So if you say that you want to heal, we have to use words and thoughts that are going to calm our nervous system and help us trust our body. Trust is a huge part of it. If you can't trust your body, every sensation, every problem, you're going to freak out and worry. So helping them to build that trust, I would say, is a big central part of the healing process.
I love that. I see that definitely in GI as well. I think a lot of times I'll tell my patients, like, we're working to be on the same team as your body. And because if you're working against your body, it's like, it
Yeah.
never works out. You know, even if your body is dysfunctional, like there's usually a reason that that's happening. So being on the same team to tackle that is always better than trying to then fight your body that's also fighting something else, and you're just,
Yeah.
you know, a mess. And I'm glad you mentioned that with therapists. I was curious how often you work alongside therapists, because I think that this is an area I think a lot of people sometimes are afraid to talk to even therapists about. And I find that sometimes I have to push my own clients of like connecting intimately to a partner while you are working on the things to then lead to like intercourse, or, you know, rebuilding trust in your body, or if there has been trauma or something in the past, like being able to like work through that. Is that something that you do see often with patients who are working in therapy as well, where they're kind of tackling that side, and then they have even, I guess, a different level of success, like being able to kind of heal from multiple angles?
Yeah, I mean, I would say that we see patients from every corner. The people who have never done anything, they haven't gone to sex therapy, counseling, et cetera, and they still get better. And we also see a lot of the people who have done a lot of the mental health work, right? And for maybe years, they were thinking that their sex issues was a mental block. And they worked through a lot of the anxiety. They done process every ounce of trauma they can find, and they're not able to have that pain-free sex. And so I think that it's definitely supportive, just because understanding your mind, understanding your triggers, especially if there's trauma like medical trauma, sexual trauma, even just emotional trauma growing up. Maybe you grew up with parents that were constantly yelling at you or beating you. Um, uh, well, I got beat. That word beating you is relative, but you know, for something that is sort of stopping you from even touching your vagina. Like we have encountered patients who were just not ready for this process. Because what we're doing, you know, we're pelvic floor physical therapists, so we're going to get physical, right? And so for some people, this is, I would say, rare. It's only happened about 2 times where someone could just not even take the dilator to their vaginal opening. Like just the thought of putting the dilator there, they would start crying, and we'd try and coach them, but they needed mental health support, right? So usually when it's to that point, mental health support is needed. or if you just want that support because it's affecting your relationship so tremendously, then of course sex therapy or couples therapy is helpful. But sometimes calming the pain and opening the pelvic floor releases the anxiety and releases the depression and releases the fear because now it's not hurting and you can actually connect with your partner physically and sexually. So again, it's a bi-directional relationship there. And so if your pelvic floor is dysfunctional, that can absolutely lead to mental health dysfunction. And then we know that the mental health dysfunction can drive the pelvic floor to be all guarded, scared, tight, and painful. So I guess we need help for the whole body.
Yeah, absolutely. And I like that you mentioned that because that is very interesting that a lot of the people you see probably have exhausted those other resources. And I'm sure that kind of like on the opposite end, they might have felt like, well, I'm doing everything right. And it's like, oh, well, maybe this is another solution or another option for you of something you haven't necessarily tried that can offer a lot of relief.
I also wanted to add a lot of women with either GI, pelvic pain, or sexual pain have been told that it's in their head. So,
Yeah.
like, I think a lot of women are struggling between, am I being gaslit or do I really need some sort of counseling for why I'm in pain? And so counseling is an amazing thing. I think everyone should do it, even just for an assessment, like let's just check. But I think to a certain point, when you're dealing with physical pain, you're dealing with pelvic dysfunction, it's not in your head, it's in your pelvis, right? And so I think that women have just been through a lot, so much disservice and invalidation. And so getting with providers that actually feel and believe you and trust that what you're feeling may be impacting your mental for sure, but there is some pelvic stuff going on that we need to fix and we need to address.
Yeah, I'm so glad that you brought that up because I agree. I think a lot of people like you start having those conversations and even rooted back to like menstruation, right? Where we're taught the bare minimum, or we were, I guess I'm 33. So whenever I was in school, like we were taught the very bare minimum and basically taught like, yeah, it's going to be painful. It's going to be terrible. Like just get through it, like move on. And then it was shameful for some reason for us to talk about, which now I think there's a turning tide to that where there's a lot more conversations happening about what is normal, what's not normal, like what can help, what other conditions exist that may cause issues like endometriosis or PCOS or whatever it may be. And so there's a lot more conversation happening now, but we have people in their 20s and 30s and 40s and beyond that didn't get that young at a younger age. And I see that feed into GI where it's like, well, this is shameful. And then you have GI issues as a kid or around that same time, and that's shameful. And then you become an adult, and it's just all about, well, you need to just figure it out. And then you can't talk about it. And then you throw this into the mix where it's like, well, then pain is also uncomfortable. And then it's just a lot of it is a lot of gaslighting from the whole world, not even just one person, which I think sometimes can be harder to even address. If like it's not that one doctor told you that, but societally, culturally, we have been told a lot of these things, and it's good to challenge those. What if someone is struggling with this? Because I think it's easy for us to say as providers, like, oh, we can screen for pain, we can screen for signs of like abnormal pain versus what might be normal. We can help explain what's going on and treat it and address it. But if someone is struggling and their doctor has not asked any of these questions, how would you recommend someone start the conversation? Or would you recommend they start it with a partner first, with a trusted friend, go straight to their doctor? Like, how do you typically recommend that conversation start?
Well, if they're having pelvic floor symptoms, you can go straight to the pelvic floor therapist. You don't even have to ask your doctor for a referral. That's nice, and it can probably shorten the process. However, the field of physical therapy is now a doctoral level. So they have changed everything to where before you needed a referral from a doctor, but now we're considered first care providers or primary care providers. So you can actually go straight to us. And if you're having like a specific pelvic floor problem, I would say a specific pelvic floor problem is like prolapse. That's a little bit more niche down as opposed to like my pelvic floor is weak, or I just had a baby and I just want to strengthen my pelvic floor. Prolapse, I feel, is more niched. Also, vaginismus and sexual pain is more niched. So if you can look for a pelvic floor therapist, quick plug for myself, that actually like studies your specific problem, because that requires a bit more skill than general pelvic floor treatment. It's the same with the gut. Like me, I struggled a ton with like eating spicy foods for a very long time. It got to the point where I would I would have to like run home because like I'm about to poop my pants while I'm out. But yet I didn't want to give up these spicy foods. And I have not given them up, but I found out that my PCOS was linked to insulin resistance. And the insulin resistance was linked to inflammation, and the inflammation was linked to poor tolerance to spicy foods. So now I can eat spicy foods, not a ton of them, but I'm not having the same issues. And so I think like if I'm going to go to a gut doctor, I'm going to go to someone who likely deals with food sensitivities, or a doctor who probably knows more about insulin resistance. And so I think that, when you're looking to get care for your body, a lot of us don't want to take a big risk, whether it's like maybe the doctor is more expensive, or maybe you've already tried it before and you feel like trying again is a huge risk. Take the risk, because your body is your home. I mean, we have to invest in our home, and who wants to live in a home that feels unsafe? I mean, so I think that it's so crucial to encourage women, especially, that it's okay to invest in yourself. Like we invest in kids, we invest in our partners, like we will forgive our ex a million times and let him come back. And like we're always giving and giving people grace. We got to give to ourselves in that same vein. Um, so thank the Lord I can eat spicy burritos now.
Yes. And that is always the goal. The goal is freedom, right? And that's what a lot of us like what we do. And I always say that we're not necessarily in preventative health, but like we're, I guess, you like dietitians and physical therapists, we're in like a different side of healthcare that is more focused on, okay, what is the actual result here? How do we improve quality of life? Like, how do we target what you actually need? Like the personalization involved. And this specialty, I guess therapy and psychology could be like this as well, but it's really special within healthcare. And so finding people who, yes, connect to that and then have the time and ability to provide that individualization, like can sometimes be the biggest game changer for your practice. And I'll link your practice below. So if anyone's interested, like we'll have that linked in the show notes. Do you work with people all over the country, all over the world? Like how does that work?
Yep, we work with people all over the world. We have patients in Australia, London. We've had people in Zanzibar. Okay. So sometimes it can be, we have to find the timing that works best if you're on a drastically different time zone. But one of my therapists, she works in LA, so she's on that Pacific time zone. She's able to help people that are more so like in Europe and stuff. Then we have my other therapist, she works in Dallas, and I'm in Huntsville, Alabama. So we work with everyone and we provide coaching. So all of us are doctors, we're all pelvic floor therapists, but so that we can work with anyone and location won't be a barrier, it's under a coaching umbrella. And that's what really allows us to sort of tap into more things that are not so clinical and white coat, and get into how are you thinking? How's your confidence? Like, um, are you using your dilator in a sex positive way as opposed to like just sticking it in? Like all of those things are really helpful. And those aren't things that we learn in physical therapy school at all. So I'm very thankful that we're able to coach women, like we're your big sister who also happens to be a doctor. So that's what we do, and that's how we do it.
Wonderful. Well, I'll link all of that. So if anyone is interested in connecting to Dr. Janelle, I'll link that as well as Instagram. So if you want to enjoy content, I always think that's a great place to start with getting to know providers and even connecting to topics and concepts a little bit deeper. Janelle, anything that you want to share before we close down? Anywhere else that people can find you? Anything you want to plug, or any last words you want to say?
No, I just want to remind people that, this isn't your last stop. If you feel almost like you're going to give up, or you're starting to envision your life without sex or without even becoming a mom, it's not your last stop. Those are lies. And you haven't gotten the right support or the right training. Don't give up on yourself. Buttery, pain-free sex is possible for you. And providers like Erin and I are here for you. And we can't wait to see you on the other side.
Couldn't say it better myself.
Are you listening to today's episode with the main thought being, what are the steps that I can take to get rid of my symptoms right now? While I hope that the information that we share in every episode of The Gut Show leaves you feeling more empowered and more confident in your body, it's not always going to solve your problem or give you a clear direction for your specific symptoms and your needs. The Master Method membership is an online program for the person with chronic digestive symptoms and IBS who wants step-by-step guidance to understand their body, address the drivers of IBS, reduce symptoms, and build resilience in your gut long-term. This membership includes a step-by-step course and a dietitian-led community that teaches you how to holistically address each symptom and the IBS drivers, how to reduce symptoms more strategically and with confidence, and guidelines for better gut health long-term so that you're not only thinking about today, but you're also improving your outcomes in the future. It is time to ditch the symptoms and get your life back. The membership is your first step. You can learn more and enroll at ibsmastermethod.com and use the code GUTSHOW, GUTSHOW, GUTSHOW for $25 off your enrollment fee.